Hello everyone. Today we'll discuss the part 69 of the NEET PG important questions, and today we'll discuss few more questions about the topic front of thigh. The descending genicular artery is a branch from which artery? Femoral artery. Descending genicular artery is given in which area? So it is given in the adductor canal. Anterior layer of the femoral sheet is derived from fascia transversalis. Posterior layer of the femoral sheet is derived from fascia iliaca. Now very important, what are the contents of the femoral sheet? So in the lateral compartment of the femoral sheet, there is femoral artery and the femoral branch of the genitofemoral nerve in the lateral compartment. In the middle compartment, there is femoral vein, and in the medial compartment, there is lymph node of Rosenmuller. Boundaries of the femoral ring is formed by anteriorly by the inguinal ligament, posteriorly by the pectineus muscle, and medially by the lacunar ligament. Which structure pierces the femoral sheet on the medial side? Great saphenous vein. Which structure pierces the femoral sheet on the lateral side? So, femoral branch of genitofemoral nerve. So, on the medial side there is great saphenous vein, and on the lateral side there is femoral branch of genitofemoral nerve. Which structure pierces the femoral sheet on the anterior side? So, superficial epigastric artery, superficial circumflex iliac artery, and superficial external pudendal artery. Which is the largest branch of the lumbar plexus? So, it is the femoral nerve. Femoral nerve enters in the thigh behind inguinal ligament between which tendons? So, between the iliacus and the psoas tendon. Femoral nerve is splitted by which artery into its anterior and the posterior division? So, it is the lateral circumflex femoral artery. What are the branches of the femoral nerve? So, it has two branches, motor and the sensory. So, motor part is the nerve to pectineus, nerve to Sartorius, and the muscular branches. And the sensory part, it is the medial femoral cutaneous nerve of thigh, intermediate femoral cutaneous nerve of thigh, and the saphenous nerve. Femoral nerve supplies which structures? So, it supplies first of all the flexures of the hip, that is the pectineus, iliacus, and the Sartorius. Extension of the knee, there is a quadriceps femoris, and the skin of the anteromedial thigh and the medial leg in foot. Longest cutaneous nerve of body is which nerve? So, very important, it is the saphenous nerve. Saphenous nerve arises from which division of the femoral nerve? From the posterior division. Hip joint is supplied by femoral nerve by which articular branch? By the nerve to rectus femoris. Pectineus muscle is supplied by which nerve? By the femoral nerve and the obturator nerve. Rectus femoris muscle is which type of muscle? So it is a bipinnate muscle. Now very important, what are the boundaries of the adductor canal? So the roof or the anterior part of the adductor canal is formed by the Sartorius muscle medially and vastus medialis laterally, and the floor, that means the posterior part, is formed by the adductor longus and the adductor magnus. Now what are the contents of the Hunter's canal? So the Hunter's canal, or we can say adductor canal, or the subsartorial canal, the contents of it are the terminal part of the femoral artery, the terminal part of the femoral vein, deep lymph vessels, saphenous nerve, nerve to vastus medialis, and the terminal part of the obturator nerve are the contents of it. What is the action of the Sartorius at the hip joint? So it is the flexure, abductor, and the lateral rotator. Subsartorial plexus is formed by saphenous nerve, obturator nerve, and the medial femoral cutaneous nerve. What are the action of the Sartorius at the knee joint? So it causes flexion and the medial rotation. What are the actions of the iliacus muscle at the hip joint? So it causes flexion and the medial rotation. Iliacus is supplied by trunk of femoral nerve by which nerve roots? So by the L2, L3 roots. Knee joint is supplied by femoral nerve by which articular branch? So by the nerve to vastus lateralis, nerve to vastus intermedius, and the nerve to vastus medialis. Sartorius muscle is pierced by which nerve? By the intermediate femoral cutaneous nerve and the infrapatellar branch of the saphenous nerve. Psoas major muscle is supplied by which plexus? By the L2, three roots of the lumbar plexus. Which is the largest muscle of the body? So it is the quadriceps femoris muscle. So today up till here, I hope you found this helpful. We'll cover further topics very soon. Thank you so much.